I think what you do need to concentrate on is anything in the pipeline. And I'd be probably looking ahead towards 25, 26 for when you're going to go through NICE to determine A, whether it's impacted by those services moving, and then B, putting together a list of people within ICBs that you need to contact. Now, I don't know the specifics. I imagine there will be somebody who has overarching responsibility for medicines management within the ICB. Within this document, incidentally, it talks about what's going to happen to the NHS England hub staff, and they are going to transition across to the ICBs over time. Some will still be maintained at the regional level because they're still highly specialised, and other services that are going to stay centrally managed. But there'll be somebody, I imagine, who is in overarching control of medicines management, and that's, to my mind, the person that you should target. If your medicine is particularly one that's going to impact healthcare resource, which I think is important at this point in time because of the, let's say, the mess that the NHS is in, then you'd be wanting to perhaps try to maybe get in to see the finance director or the medical director if they're willing to see people from the industry to talk about how you can impact this pathway through the use of your particular medicine versus anything else that's available, or maybe it's you're the first medicine for that particular disease, and you'll be able to show them how you can shift resources to invest in better care, whether that's upstream or around the use of your medicine, but clearly that it releases capacity within the system, be that nurse time, pharmacy time, bed time, GP time, and you need to start looking at those sorts of models and almost forget about the clinical benefit. I know this sounds really bizarre, but the fact you've been through NICE have said you're cost effective and obviously clinically effective, that's almost a given. But what isn't a given is your wider impact if you have those things. And those are the things I think you need to sell to the NHS moving forward. And like I say, go into the ICBs and think about the whole pathway and how you can impact the whole pathway.